Now, one of the bigger challenges facing any developing nation is getting its healthcare messaging right. The proper dissemination of information, whether it be on HIV/AIDS or TB or the like, can not only save lives but also money as well. With some strong views on that and plenty of experience, we join now on Newsnight by Rohit Sahgal, who's just arrived in South Africa to head the local office of the McCann Healthcare Worldwide Group. Welcome, thank you very much for joining us. I think you arrive at a very opportune time. One of our big stories tonight, 6 babies dying, and I'm sure you're aware of it, in seemingly preventable circumstances.
That's right.
Better communication, I'm sure you'll tell me, might have prevented this.
No, you're absolutely right, Jeremy. I think the answer, is linked with health economics as well, because I think as prosperity and as lifestyles improve, so along with that comes some, unwanted accompaniments such as lifestyle diseases. What we now see is actually, diabetes has actually now exploded here. Almost 8% of the South African population is diagnosed as diabetic. And what we can also understand from that is that's just the diagnosed population. So we can understand that there's probably at least another 10% that's pre-diabetic. Cardiovascular issues, and when you actually come to the issues about infant mortality, unfortunately those are the areas that then start to become a key area and a key focus for education, because without education we can't really begin to tell the medical fraternity, the layperson, the mother, the community as a whole.
On the surface, though, it would seem to be a fairly easy thing to do.
It seems like it, but I think when you look at, from a GP's perspective, from a doctor's perspective, let's look at it fairly. He's got a lot to do. I think, in an average day there's everything from, cuts and scrapes to possibly someone who's got cardiovascular issues, and we expect the doctor to know everything at any given moment. But there's really no time for him to have his own education. Pharmaceutical companies are trying to do this, but in South Africa, as you know, it's a generics market, and when it's genericized, there's very little value-added education going to the doctor.
Pharmaceutical companies traditionally have one interest at heart, that's their own, and also driven by profit.
Well, that is, I guess, as pharmaceuticals are branded. But I have to say, in the last 10 years of my experience and associations with pharmaceuticals, there has been a focus now that they need to educate, because the explosion across emerging markets, and that's China, India, now South Africa, on lifestyle diseases particularly, is going to be a huge burden. And pharmaceuticals are concerned with that as well, because sometimes they don't have the pipelines for pharmaceutical drugs to answer everything. Lifestyle diseases, I think, has to be a focus of education, because the other parts of it, whether it's HIV/AIDS, whether it's preventable diseases, are easier.
Are they not coming to this too late?
Well, better late than never, because I think when you look at the cycle that South Africa is in right now, it's been 16, 18 years that it's actually now flourished, and you can now see South Africa becoming, I think, a focal issue now with pharmaceuticals. It's the right time for them to at least prevent the explosion. 8% of diabetes out of a population of 43 million can be prevented from turning into 16%. Better late than never.
So if we're talking about education, is it a lack of money and resource, or is it simply a lack of strategy and will?
It's probably a mix of both. I think, Jeremy, with the education requirements right now, it's so diverse. You have different demographics, you have different education. Coming back to the story you said about infant mortality, could education have prevented that? Was not just the hospital, but perhaps the mothers and the families aware of what some preventable items could have been? I think it's really up to us, and I think it's really up to communications to
Very quickly, you come in with a global perspective here. Is it your sense that we might be getting this right, or do we have a long way to go?
Well, I've come from Asia, and I think in Asia, my feeling has been that no one's getting it right, but here I can see such an effort, whether it's in public health, whether it's through pharmaceutical efforts. The generic companies themselves are doing a phenomenal effort, I have to say that.
Appreciate your time. Joining us here on Newsnight is Rohit Sahgal from McCann